Welcome and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. As many of you have joined our program over the last 10 years, you see that we try to prevent and present wonderful modalities for healing that commonly aren't known out there in the world of the medical profession. And I'm sure that there are a lot of stories out there of people with serious illnesses, whether it's HIV, AIDS, or it could be stage 4 pancreatic cancer, lupus, MS, you name it. It's all out there, and sometimes there are just these big industries, especially in the pharmaceutical industry, that would rather have us medicated on trials that seem to give us more side effects that make our condition even worse than what it is we're trying to treat. And this is one such story we're going to be talking about today as we bring back a guest we've had on our program before. And she started out with the same situation, which could be tremendously frustrating, as her husband had suffered from a brain tumor about the size of an orange. And this is what began her on a wonderful journey to become what she terms herself to be a patient advocate. That is someone who's out there for people just like you listening on the program who are looking for health and healing modalities that actually are very effective. We're not talking about low percentages like radiation, chemotherapy, and the like, where you get a 1% chance of recovery and perhaps healing from cancer, but things that are even more impressive than that. But then at the same time, there's the awesome pull from the other side. That's the doctors, the people that we go see, that we place our trust into when it comes to our health and healing. The book is Honest Medicine, and our guest joining us here on the Beyond 50 radio program is Julie Shopik. Julia, how are you today?
I am fine. I am so honored that you wanted to have me back so soon. I'm delighted.
Well, you know, I'm out there in the community, and I myself have, I can understand the frustration having my own son go through a situation which blindsided us, and it's something that, you know, isn't to the level, let's say, an autoimmune disease. But you take a look, I actually had sort of a battle in a way with a nutritionist. And what was interesting about this is that at the time when he was out of his coma and he was basically in the hospital, and one of the ways they had to feed him was through a tube that was down his nose, and how that works, and it was this canned food that she claimed gave him all the nutrients he needs. Now, Julia, here's the funny thing. At that time, I was actually doing a lot of investigating, journaling on my own to find out, you know, what is the right healthy diet? Because back in the late 80s and 90s, it seems everybody was popping up with some new diet and new way to eat that was great for you.
Right.
So I thought I would dive in and look at the most common sense things that were out there, and I came across several books, but one of the things they talked about was the storing of food and how when you put it in a can, which this was in a hospital, you know, it was in a can, and it goes into this tube, it goes down his, you know, through his nose, and then this is what actually feeds him. And my understanding is that most food, when it's put into a can for storage, the nutrients value dies. You know?
Absolutely right. You know why? Of course, it's put at such a high temperature.
Exactly. And there you go. And I'm sitting here thinking, this is a medical nutritionist telling me this can of food is giving him everything he needs. And I'm supposed to buy this.
Oh, I'm sorry. I bet some of the ingredients were sugar, glucose.
Oh, I'm sure. Mm-hmm. Now tell us, you know, just kind of refresh our listeners about your story with your husband here.
Well, my story has a lot of similarities to what you're talking about. In 1990, my husband was diagnosed with a very serious brain tumor, as you mentioned in the intro. And we did everything. You know, with my background, with my dad being a doctor who told me to watch out for the medical establishment,
wow.
My mom being somebody who was very into holistic and alternative medicine, you would have thought that I would have, you know, said, okay, let me start researching right away. But I didn't. I got terrified, and so did my husband, just like most people out there. I mean, we went into lockstep with what the doctor said. And luckily for us, I mean, you mentioned that the tumor was the size of an orange. We definitely could not just ignore it. So he did have the surgery, he had the chemo, he had the radiation, and then I began to notice that he was suffering every side effect. I mean, if you just looked up side effects, you know, of these treatments, he was getting them. And, I mean, for instance, he had hydrocephalus, which is water on the brain, which is swelling. he also had a radiation-caused stroke. I don't know if you know that, but you can get a radiation-caused stroke if you've had radiation to the brain.
Wow.
And he had seizures, and he just was not doing very well. And I said to myself, you better start doing some research. Light bulb moment, right?
Right.
So I started doing research, and just like you, I was noticing that all the food they were giving him in the hospital was just horrible, had been giving him in the hospital. It was kind of Boost. If you look that one up, it's got loads of sugar in it. But I found a nutritionist whose name is Jean Wallace, and she really knows her stuff when it comes to cancer and brain tumors. And then Tim started getting better, and he started thriving, and he started living longer than the doctors had predicted. They predicted 3 years, 18 months to 3 years, and he really started outliving that. He was living 4, 5, 6, 7, 8, 9, on and on. He ended up living 15 years after his diagnosis. What I found was that the doctors were not at all interested in what we were doing. They acknowledged that he was their star patient. They had to, because it was looking great. But they did not want to know what it was we were doing. Tim tried to tell them, actually. At one point, he said to the doctor, I'm taking a lot of supplements. Would you like to know what I'm doing? And the doctor said, no, next question. I know. But then in 2001, he did have a recurrence. And I want to stress that usually recurrences of these very, very cancerous brain tumors come very quickly. His came after 10, 11 years. And against my better judgment, because I was making his health decisions, he was very happy with his progress, I let him have this surgery. And he walked into the surgery telling jokes. I mean, he was in great shape. And except for the tumor that wasn't giving him any symptoms, but it had shown up on a scan. And this is where both shoes, they talk about the shoe dropping, both shoes dropped.
With a body in them jumping off of a cliff, so to speak.
Exactly. Daniel, his skin just wouldn't heal. And I knew we were in trouble. I mean, the doctors kept doing what they know to do. They kept dragging him back into the operating room. Are you ready for this? To try to find 2 pieces of skin that would hold together. After they had exhausted all the skin he had on his head, practically, they started taking grafts from other parts of his body. I mean, it was horrendous. And nothing was working. Nothing. Right after each surgery, it'd start to open up again. There's not much loose skin on the head. And then, with serendipity, I guess it's the only word I can use. Maybe Bernie Siegel likes to say there are no coincidences, just God incidences. Maybe it was a God incidence that I was talking with a doctor whom I was doing a press release for a client that a PR client, and he asked me, I also knew him, semi-socially, and he said, how's your husband? And I told him, and he said, woo, his skin is not healing. Have you heard of something called Silverlawn? And then he proceeded to tell me about this treatment. It's pieces of material with silver ions in them that, when moistened, will heal. We're FDA approved, actually, for all non-healing wounds. So I got my PR skills all together. I called the head of the company that made Silverlawn, and we got it on Tim's head. It's spelled Silverlon, by the way. We got it on Tim's head, and it started to heal immediately. And this is when my aha moment just started breaking out in song, or whatever you want to say, because his skin was healing. This is after 8 surgeries that were just making him worse. And I found that the doctors just weren't interested in what healed him. And as a matter of fact, one doctor came up to me and he said, I don't think it was what you found that healed your husband's skin. And I was like, what? What do you think it was, doctor? And he said, well, I've been thinking. And he said, I think it was the vancomycin. That's the IV antibiotic that Tim had been on for 6 weeks. He said, I think it was the vancomycin. And I said, but he's been on vancomycin for 6 weeks. And he said, that's right. He said, vancomycin is like that. It kicks in. Well, you can just imagine. You laughed. I almost cried. I did think it was funny, I mean, actually I did, but in a very horrible kind of way. Mm-hmm. And that was when I decided that there were treatments out there that your doctor just doesn't want to hear about because he has not heard about. He didn't hear about it from his colleagues, he didn't hear about it from his medical journals, and he didn't hear about it in school. And I decided there must be several of these treatments out there, and by God, I was right. My hunch paid off. And I decided I was going to write a book, and it was going to be about treatments like Silverlawn that are time-tested. I mean, silver's been healing wounds for years, and that have been around. I set the bar to at least 30 years, 25, 30 years, and that are inexpensive. We had gone broke finding treatments for Tim. I wanted them to be inexpensive, time-tested, effective, and I wanted them to be non-toxic. Mm-hmm. Because so many treatments are expensive, toxic, and don't work, Mm-hmm. So that's what I did. I hope that wasn't too long-winded an explanation, but that's how I got from there to here.
Well, we don't mind long-winded here on the program as long as there's a lot of really great information where people say, okay, you got my attention a little bit here. Let's see how much further we can go. And one of the things that I would like to encourage the listeners to know is that in your book, Honest Medicine, as you talk about 4 healing modalities that you discuss in the book and how they were applied to, it seems like quite a multitude of things, some very serious things.
Yeah.
And here's the clarity I would like to lend. You just said it, I think is one of the most important points. You said non-toxic. So it's fair to say that if a person was to even approach using any one of these 4 for whatever reason they need to, you're saying there is really no negative side effect.
Well, the answer is yes, but I'm going to do a caveat with that.
Okay.
For instance, you're going to be interviewing Jim Abrams soon, who is he's Mr. Ketogenic Diet, not a doctor, but he's the person who has spearheaded the reawakening of the ketogenic diet for pediatric epilepsy. And I want to stress that with this diet, which is not dangerous, it's, we said non-toxic, it must be done correctly. Or there can be, it's a high-fat, low-carb, low-protein diet. And if it's not calibrated correctly, which is why Jim is so active in getting hospitals, he hired a dietitian to teach dietitians all over the world, not even all over the country, to administer this diet because each child has to have it administered differently, weight, preferences, all of this. And if it is done incorrectly, one of the stories in one of the contributors to my book, To Honest Medicine, Jean McCauley, tells how her daughter, it's a long story, but to cut to the chase, she wanted to get the ketogenic diet for her daughter. Her daughter had terrible seizures. And finally, with Jim's help, she convinced the hospital that little Julie was in, she was a baby at the time, to administer the ketogenic diet. They did it wrong.
Oh, no.
And she ended up almost dying in a coma. Now, the good news is, the bad news is that because she didn't find the diet, the symptoms she had before really did cause many. She had terrible reaction to phenobarbital for her seizures. The seizure med. The things that happened, she got Stevens-Johnson syndrome, which is terrible, terrible rashes and all that. All of those things have had their lasting side effects. But once the diet was administered correctly, she never had seizures again. So each one of them, has to be done correctly. As you know from our conversations, the one that probably is easiest to get, and even though it's not easy, the doctors, don't like to prescribe it, is probably the one for autoimmune diseases because it's not an injectable. It's not, it doesn't have the possibilities, of not doing the diet right. So I'm kind of concentrating on one of the treatments that I wrote about in my book, In Honest Medicine. I'm writing another one totally about low-dose naltrexone for autoimmune diseases. But no, in general, these treatments are all much less toxic than the treatments that doctors prescribe. I mean, they're terrible treatments, these anti-seizure medications. Oh, my goodness.
And the reason I asked that, Julia, is because I wanted our listeners to have some clarity about what we have brought on the show, and that's a very consistent question that I ask, and that is, what are the side effects, if any? And most of the time with these, and they can be considered alternative healing modalities, even though, as you just mentioned, and I have seen most of these, they go back, 25, 50, 100 years. And it's amazing worldwide how some of these have been used very regularly, just not here for some reason. And I wanted people to realize, look, okay, if there's no side effect that's really damaging, really toxic in any way, what could it hurt if it's low cost for you to just try and see where it takes you?
This is the question.
Exactly. And that's the point, because aren't we looking not for somebody's grand knowledge and credentials to bring us to the promised land of the ultimate healing process, but aren't we interested in the effect that we actually get that healing that we're looking for?
One would hope.
Mm-hmm. Now, on this low-dose natoxone, tell us about that. What is it, and give us an idea of how this is applied.
Well, this is a fascinating treatment. All the treatments I write about, Daniel, in my book, In Honest Medicine, have very interesting histories as to how they came about. Like I told you about Jim Abrams spearheading the ketogenic diet.
Mm-hmm.
This one, I think, is probably the most interesting in that I'll start by telling you about Dr. Bernard Bahari. Dr. Bahari was a Harvard-educated neurologist, psychiatrist, double board certification, and he was working in New York City's government when he was working as a drug addiction specialist. He even ran some methadone programs there. Methadone, the medicine used for drug addicts.
Mm-hmm.
And at that time, a drug called naltrexone, Naltrexone, was FDA approved at 50, that's 50 milligrams, and it was approved for drug addiction. And it was approved about 10 years later for alcohol addiction. And I am not a medical person, but I can tell you that the principle of this is that in these high doses, when people would take naltrexone at these high doses, somehow if they would try to take heroin, it wouldn't get them high. It just, it was like a miracle, except for one thing.
Mm-hmm.
At high doses, Dr. Bahari, as I said, he was working with drug addicts, right? He said, let me try this. And he found that at high doses that it was approved at, people were having terrible side effects, just awful. The way he puts it in an article that actually is on my website, on Honest Medicine, the way he puts it is things that they could do the day before they could no longer do. They were so strung out, because this had such side effects at 50 milligrams. But this was a curious doctor. I love that word. Usually it's kind of an oxymoron to talk about a curious doctor, and usually they're not, right?
He's obtusely intelligent.
Right. I love it. I'm going to write that down. Obtusely intelligent. Wonderful. Not wonderful, but a wonderful phrase. Not wonderful at all. Anyway, he was very curious, and he noticed that he said, this drug, I can't use it for drug addicts at 50 milligrams. Forget that. But he said it seems to have endorphin-raising potential or capabilities, and it seems to do something to the immune system. Let's see how low we can go and still get the good effect without the bad ones. He was now not even thinking of drug addiction. A lot of the people who were drug addicts, by the way, had HIV/AIDS. We know that. And it didn't have a name then, however. But it was, the gay, it was called then the gay virus, And he started titrating this naltrexone down, and he finally gets it down to like 3 milligrams, and he finds that it still raises endorphin levels, and it still, what he called, regulates the immune system, orchestrates, modulates the immune system. And he said, this has a wonderful effect on the immune system. And then one of his daughter's friends, a gal named Chris Lombardi, came down with multiple sclerosis. And at this point, there were no MS drugs. So she came to her friend's father, Dr. Bahari, and she said, do you think this what he now called low-dose naltrexone, do you think this might work? You've been talking about, how it works for the immune system. Dr. Bahari said, what's the, no problem trying it. And he said he had a feeling it would. And it did. Her MS stopped in its tracks.
Wow.
I know. And then, this was before the age of the Internet. All we had was pencil and paper and phones,
Mm-hmm.
And the word got around that this man, Dr. Bernard Bahari, was working with something that seemed to do wonderful things for people with immune system disorders. And people with lupus, with fibromyalgia, with Crohn's disease, with MS, of course, with rheumatoid arthritis, with asthma, started coming to him and finding excellent results with this, what he now called low-dose naltrexone. And that is what it's called now. And what I love about it is that this is something, it costs less than $1 a day,
Wow.
And I know. And the problem is, there's always a problem, right? It has to be compounded by a compounding pharmacist who knows what he or she is doing. But even if it's compounded wrong, which I please, don't, do go to a good compounding pharmacist. One that I always recommend is a man named Skip Lenz, because he has compounded LDN, low-dose naltrexone, or LDN, longer than just about anyone else. But if compounded correctly, it can have wonderful results. If not compounded correctly, you just won't see good results probably. But, no harm done. And only good done. And this has taken off. It's taken off like you wouldn't believe. There are loads of Facebook groups. You noticed that when I was on your show the last time, we got lots of listening going on, because I put a link to it on several LDN Facebook groups.
Okay.
And they love it when LDN is being talked about. These are patients who have seen wonderful results with low-dose naltrexone for various diseases. So now I call it a cause célèbre. People are just they're trying to talk with their doctors and get them to prescribe it. If the doctors don't have luck, if they don't have luck getting their doctors to prescribe it, they're finding other doctors who will. And I'm doing teleseminars. I'm conducting teleseminars and coaching, personalized coaching, to help people to convince their doctors to prescribe it. And if their doctors won't prescribe it, we can talk more about what I do, if you'd like to.
Mm-hmm.
But if they won't prescribe it, I can at least get them to the point where they can say, okay, doctor, I understand that you don't want to prescribe something that your friends aren't prescribing. That I put it that way. I don't tell them to say that, but that's the idea. But if I get somebody else to prescribe it, will you still be my doctor?
Mm-hmm.
And they're getting excellent results this way, because they're getting their doctor to be at least on board to a certain extent. Often their doctors are prescribing it now, and that's wonderful.
Mm-hmm. Now, there's the thing right there. As our listeners are listening to this, and they're thinking, well, this sounds good. I'm going to take this to my doctor. And I actually had an experience like this back in the 80s, and that was when the yeast syndrome books were starting to come out about Candida and all the problems Candida can actually cause.
Oh, gosh, I remember that book.
You remember that? And it was interesting because my mother started talking to me about it, and she says, I want to let you know, though, that if you go and talk to a doctor, this is probably what you'll hear from them. Oh, every few years somebody out there comes up with a book, and, it's sort of like a fad, and he dismissed it. And so I happened to go in for a checkup about a month later, and I decided, I'm going to go ahead and test the waters on this. And so I brought it up, and that's exactly what this guy did.
Yeah,
And the question then becomes this, okay, our listeners might be people who are affected by perhaps an autoimmune disease situation here, or they might know somebody. After all, 1 in 5 of us, as you claim in the book Honest Medicine, probably has, one of those type of autoimmune diseases that we've been mentioning here. And they decide they want to approach their doctor about this, but they might get spearheaded because all of a sudden it'll be, look, I'm the doctor, you're the patient, let me do what I do well, let you do what you do well, and we'll have a great relationship. what then should be the next best steps for a person to take?
Well, if I think that it's important that you're bringing up a good point that people approach their doctors in a way. Doctors, in their defense, and I don't often talk in their defense, as you know, but there is, my dad used to call it, my goodness, they bring me all this stuff from at his time it was Reader's Digest. They come in with loads of articles, and now they come in with loads of printouts from the internet, kind of not in a very orderly fashion, and some of them are some of them are good and some of them are bad. This is where I help them because I prepare a packet for people. This is in the individualized coaching and also in the teleseminars that I do. A packet for their doctors that really carries weight. LDN or low dose naltrexone does not. It has some very impressive small clinical trials done by institutions, by the way, like Penn State, like Stanford for fibromyalgia. Penn State studies were for Crohn's, and University of California, San Francisco for MS. So there are impressive studies. But I give them materials that will convince their doctor, but not if you just hand it to the doctor. I tell them how to present each piece of information, each article to their doctors. And I tell them I show them how to present it and how to ask for, doctor, are you willing to read this? And, don't just shove it at him, right?
Right.
Or her. If they're willing to read it, you're golden, because then you say, can we set up an appointment in how long, doctor? A week, 2 weeks, 3 weeks? You tell me. Give him some of the power there, right?
Mm-hmm.
And then can I come back? I'll make another appointment today for whatever time frame you say, and we can discuss this treatment. And, by then, remember, the patient has kind of given the doctor a bird's eye view of what to look for in all of the, there's only about 6 different pieces of information, but it's a lot to read. You can't just read it sitting there,
Mm-hmm.
And the surprising thing is, although I'm not that surprised, because I always suspected that if you put together information in a particular way, and don't forget, I'm a former college teacher and also a PR consultant, that you have to present it in a way that the doctor won't say, oh, my God, you got 150 pages here from the Internet. What am I going to do?
I wouldn't, as a doctor, want to sit there and read through all that either.
My dad used to come in and he'd say, oh, my God, they bring in, and my dad was a pretty open doctor. But, if you bring in like 12 issues of I shouldn't mention Reader's Digest, they're going to come get me. They're still in existence, right?
No, but what's funny, though, is that there's a lot of reality to what you're talking about. They'll be bringing a magazine, or a newspaper article, and you got to consider, but did you really look at the source? You found what you wanted to read or what you wanted to hear, but how credible is the source? And that's very important. It sounds like that's what you do. You really make sure that the sources within this package that you help these people present to their doctors are very credible. That it isn't just some journalist who heard about something and said, oh, wow, and just wrote this crazy article, because we know how the media can be.
I know.
But yet I could see somebody running in, and I love Reader's Digest like anyone else, but coming in with a pile of that saying, well, here's 5 issues of this that I found this in, and you really got to read this. I'd be like, are you kidding me?
I'm still laughing for
myself. It's Reader's Digest.
I know. You know something? A lot of it is in the presentation. Now, I'm going to give one of my secrets away right here, and that is that actually the interview with Dr. Bernard Bahari, which is on my website on honestmedicine.com, fairly near the top. You just need to scroll a little bit. Is an interview that is fantastic. His widow, Jackie Bahari, gave it to me, the DVD for it, and I put it on the website. And don't laugh. I know you're going to say, my God, this woman is OCD, obsessive compulsive. I transcribed every word of the whole thing. It was an hour and a half, and my transcription skills were very slow. And I couldn't hire anyone because he was using technical terms, so I needed to hear it myself. And luckily, one publication, Alternative Therapies Magazine, which is a very credible alternative publication, with scholarly articles, they contacted me and said, can we reprint this? And Jackie Bahari and I were both delighted because then they put it in a format that looked beautiful. And the cover for that issue looked very scholarly, and Dr. Bahari's article, his interview, was listed on the cover. So I paid somebody. I first of all got permission, to use it in my educational materials as printed there, But what I did was I hired somebody to put together a PDF, of this article with the cover, so that this is something a doctor will look at and say, looks good,
Mm-hmm.
And the same with Dr. Gluck's chapter, Dr. David Gluck's chapter from my book, From Honest Medicine. It was printed in a way, not just copied, but, you want it to be easy to read, easy on the eyes. And Dr. Gluck's chapter describes why the pharmaceutical industry is not interested in this drug. And so if the doctor reads the interview with Dr. Bahari first, and then, and then this article, this chapter by Dr. Gluck as to why, very credible as to why why the pharmaceutical industry is not interested in LDN. And then you show the doctor the studies, which I have printed out looking very nice, from PubMed. They're listed in PubMed, which is what the doctors love. They always go to PubMed to look up stuff. These studies about low-dose naltrexone, small studies, but they're in PubMed. By the time the doctor gets to these, and there are a few more pieces, he or she, if he or she is reading them, could very well be convinced, and at least will not throw the patient out of the office,
And according to what you said in the book, that when it comes to low-dose naltrexone is the fact that one of the only known side effects is vivid dreams.
Yeah, I have a great story about that. My now 97-year-old mom, she doesn't like drugs. I come from a family that kind of foresaw what I was going to do with my life, right? She has a slow-growing form of cancer. It's called CLL, chronic lymphocytic leukemia, I believe. So I don't know how we did it, but we convinced her doctor to prescribe low-dose naltrexone for her because it also can be used, for cancers, for some cancers. And she calls me after the first day she tried it, or maybe a few days. She goes, I'm having such wonderful dreams. I'm enjoying myself. So some people like the vivid dreams, but they often go away after a few weeks. But my mom is enjoying hers a lot.
So you do see LDN, as it's affectionately called, being one of these big breakthroughs that may be one of the more important medical discoveries of the 20th century.
I do. And I hope, what's wonderful is that patients are now, they're getting confidence because they're hearing other people's stories, on these, there are Yahoo groups devoted to LDN and Facebook groups devoted to LDN. And I was just looking in the Crohn's forum, the Crohn's disease forum, and there's a whole subsection, that I was reading where people are saying, oh my goodness, I'm doing well with LDN, blah, 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 et cetera, et cetera. So people are getting the confidence, and then they're knowing that there are a list of doctors who will prescribe it, around the country, put together by a patient advocate named Crystal Nason Ferguson. And she put together this list, and she keeps it up. And so if your doctor absolutely refuses, but that's why I try to get people to come to me, and at least do my teleseminars or even better, my coaching, because it is better if your own doctor can prescribe it and convincing him or her, I can help you through that. But if they don't, we still have a way. And patients are getting, I'm thinking this is changing the doctor-patient, the doctor-patient relationship into the patient-doctor relationship, switching it around a little bit.
And the thing too, Julia, having been in media for many years, it really astounds me how people can take a piece of information, and if they repeat it enough to themselves, and we see this happening whenever there's an election. If I say it enough times, then it becomes true, even if it's a lie.
Right.
But the fact is it's getting people to think and to question, after all, because you're the one that has to live with the result of the decisions that you make from this, so-called higher power in a way that knows something that you don't, that is trained in a way that you are not. But you're the one that lives with this, and if you're not satisfied, you should start asking questions. And I think that's the power that we have is, that right to choose, so to speak. And it just, again, it astounds me when I hear this, and I think to myself, okay, the next time you hear something, and you go out there and, like, let's say that this LDN, that somewhere along the way somebody might leak something through the media. It'll begin to gain momentum because people start passing the information to their neighbors and friends. It's going to become something other than how it started. This is how these things work. I've seen it many times. And it gets to a point where it's believable. And the only question when that happens to me, anyway, is this. I simply say, well, if that's really true, what evidence do you have that supports this?
Yeah.
And it's amazing how shallow that road gets.
Yeah.
With just that one question.
Yep, exactly. By the way, you mentioned something that triggered something in my mind. I hope you don't mind if I bring it up. You mentioned in the United States things being more difficult because pharmaceutical companies kind of rule.
Mm-hmm.
Do you know that in Norway there is a documentary? It's in Norwegian, but now it's online with English subtitles. It was a documentary about low-dose naltrexone, and it's taken off in Norway and other countries too. My book is Honest Medicine has been translated in Poland now, in Polish, and it's being sold in Poland, and we're looking at other countries now. So, I have a funny feeling that it may be easier in other countries to convince doctors. The jury's still out on that, though.
Well, I certainly know that over the years that we've talked about natural approaches to healing modalities is the fact that it seems Europe really is ahead of the game. They don't seem to be as shackled with some of what seems to be real common, as you talk about in your book, cost-effective for just about everybody. And you take a look at the state of things in America, and even though we've got great medical institutions and that we are just amazing when it comes to the science of medicine, that it seems, and this is just my opinion, my point of view, that it's like the insurance companies and the bureaucracy get in there and muddle it all up to a point where people just have to do what they're told. And that includes doctors. And it's not pointing the fingers and saying, these are the bad guys. It's to get up, wake up, and say, what is the goal here when it comes to treating people? Is it to save money or is it to heal them? And to really start questioning that in a very intelligent way, I would think.
I think you're right. And Jim Abrams, whom you're going to have on your show, I'm so excited about that. He made a movie about the ketogenic diet starring Meryl Streep.
Oh, wow.
Yeah, you can get it on Amazon.com. It's called First Do No Harm. And that should be, that's from the Hippocratic Oath.
Right.
That should be what guides doctors. First, do no harm. I mean, some of these drugs, Daniel, that are out there for rheumatoid arthritis, for Crohn's disease, a lot of them are injectables. They're called biologics. And if you listen, have you listened to any of the ads on TV for Humira and Enbrel and Remicade? These are the drugs. And you're like, whoa, can cause...
I've listened to commercials.
I know.
And seen them on TV about drugs for PMS. Oh. And I've heard women go, I'll just suffer with the PMS.
You know what?
I would imagine why. That other list is pretty long after a while.
Exactly. But these drugs for the autoimmune diseases, they say can cause lymphomas. And, this is funny because I'm not a big fan of the FDA. But this one thing makes me a fan of them. If the pharmaceutical companies had their way, they did not want to have to tell the side effects. Did you know that?
No, I know. In fact, there was a time that you never heard of the side effects.
The FDA made them. So now they're pissed, the pharmaceutical companies, because they could have told the benefits in 15 seconds and then been out of there,
Well, here was the other thing, too, Julia, and I'm pretty sure that it passed, but the FDA, I don't know what's going on. Maybe some hippies infiltrated the FDA. We don't know. But there has been some interesting changes, but I've noticed this one, and this is a really exciting one, is there was a time that doctors would get kickbacks from prescribing. And we all have read this over the years and went, oh my, is that really true? And apparently it was. But now, I don't know if it's passed, but this is something that I just read probably about 2 months ago, and I was like, well, now that's a big step, is that no longer doctors will be able to receive kickbacks from drugs they prescribe.
Isn't that great?
You know, so now you're taking the commission away. You might want to think about actually doing what you're paid to do, you know.
Yep.
It's just really interesting, and I try not, again, to point fingers, all those big, bad pharmaceutical companies, you know, it's a business. That's what it is. Big, bad insurance companies, it's a business. You know, everybody's trying to do what they do, but it is that if it isn't working, find another way that does.
And
that's what we try to present here on the program.
I wish that there would be a trend, and maybe it's starting, you know, to do the least invasive first. I mean,
right.
If you're talking about an autoimmune disease, why would your first choice be an injectable? Tell me.
Mm-hmm.
You know,
mm-hmm.
Do you know what I'm saying? I mean, that's not easy. That's horrible, and so many side effects. So I just hope that things are changing. And by the way, there is a website. I think it's ProPublica.org. If people write to me at julia@honestmedicine.com, I can give them the link. I think it is that, though, where you can put in a doctor's name and see what the financial ties are, because there are other ways, other than kickbacks, that doctors can have financial ties. They can be paid by the pharmaceutical companies to write, quote, scholarly articles for the journals, and then they put doctors' names on them. There's lots of things that can be done that still have ties. They can be doing educational programs. I'm putting quotes around the educational programs for doctors. You know, the doctors are paid to educate other doctors, and so there's other ways other than straight kickbacks.
Mm-hmm. Well, Julia, it's always a pleasure to have you on the program, and, you know, to be able to get out there and just let people know, you know, there is another way. You know, there is a way you can pursue, but like any new way that may not be familiar, there's a process that needs to be followed that's reasonable. It really is. It isn't that doctors want to be hard-headed. Maybe some of them do. But most of the time, they're kind of protecting their territory, as they should, you know. It's a lot of money to go through medical school. And it's certainly a lot of money, you know, once you have your degree and then you're able to practice medicine, to try to avoid lawsuits, you know, for malpractice. And so there's a lot of things to look at, so you can't just, as you mentioned earlier, run in with a bunch of printouts from some stuff that you found on the Internet saying, here, you know, take a look at this, that there's procedure, and that if you follow procedure, which is a way science works, then you might find better results than you can ever imagine.
And this is why, with Honest Medicine, you know, with my book, Honest Medicine, I set the bar so high,
mm-hmm.
you know, because I didn't want it to be treatments that people could say, oh, you know what, I don't think that's too credible. They had to be very credible treatments. And these are, you know. Mm-hmm. So hopefully more and more doctors are going to be doing them. And, doctors know that the drugs they're prescribing, in many cases are not working. They know it.
Mm-hmm.
And I think I'm hoping that things are going to change. I can always hope. But
well, change is something that's inevitable regardless if we try to prevent it.
Right. It's the same thing.
Now, I have a question here from one of our listeners, and they want to know, what is your website, how they can find out more?
It's called honestmedicine.com.
Okay.
And the name of the book is Honest Medicine. The name of my website is Honest Medicine. I've got to talk to a patent attorney about trademarking that.
I think it's a great idea.
I know. I keep saying that I will, and then I don't, you know.
Well, Julia, again, we want to thank you for being on the program today. Always eye-opening to have you here to let us know what's available out there and what we can do about it.
Well, it's my pleasure, and you are a fantastic interviewer.
Well, thank you very much.
I appreciate it.
For you listeners out there, the book is Honest Medicine. You can find out more about it. Just visit honestmedicine.com. And we're also going to be setting up some stuff on our website as well, so check it out when it's up, and that is beyond50radio.com. That is the number 50. We also have exclusive e-news updates. We encourage you to sign up, come at you through your email every week. I'm Daniel Davis. Thank you for tuning in. This is the Beyond 50 radio program, and remember, live your day past halfway.